All right, this part of the conversation is going to be on inhalation anesthetics. These are gas anesthetics. That's the general term is inhalation anesthetics, but we call them gas anesthetics. The most common used ones in veterinary medicine are the two at the top. That's Isoflurane and Sevoflurane. There are other ones listed on this page, but Isoflurane and Sevoflurane are the ones that are used most often. All right, so don't worry about diethyl ether. We learned back in chapter 1 that it was one used back in the 1800s. It's not used anymore. Our focus is, with this conversation is going to be on isoflurane and sevoflurane, which are considered halogenated organic compounds, okay? And they're the most commonly used ones in this class. They are liquid at room temperature, and they're stored in a vaporizer on an anesthetic machine. So the part of the anesthetic machine that holds this liquid is called a vaporizer. And then as oxygen passes across the top of the liquid, it gets pulled by the oxygen that flows through the vaporizer and then delivered to our patients. So once again, that liquid gas anesthetic is vaporized and mixed with oxygen. The mixture is delivered to the patient via a mask or endotracheal tube, right? A tube down the trachea of the animal. The mixture then travels to the lungs, and in particular the alveoli in the lungs. And the alveoli is where gas exchange happens within the lungs and diffuses into the bloodstream. The diffusion rate is dependent on the concentration gradient of the alveoli, capillary, and lipid solubility. I'm not going to get into concentration gradients. It's just way too complex, but that's generally speaking how they reach the body. And the concentration gradient usually is greatest during the initial induction. So that's when it's most influential in the body, is at that initial induction. Distribution to the tissues is dependent on blood supply. So if an animal is hypovolemic, i.e. has a low blood supply, the distribution of this drug is going to be compromised. And as far as the lipid solubility goes, this is how it pierces into the cell walls and produces its effects. So lipid solubility has a role to play as to how this drug is going to reach through the cell walls. The depth of anesthesia is dependent on partial pressure of the anesthetic in the brain. So how it reaches the brain is based on partial pressure. I'm not going to get into partial pressure either. It is really complex, and you guys don't need to worry about it for this part. And maintenance of the anesthesia is dependent on sufficient qualities of the anesthetic delivered to the lungs. So usually this is expressed in percentages. So you have oxygen being moved to the patient, and then whatever percentage of that oxygen is carrying the gas anesthetic, i.e. 1.5%, 2%, 3%, is considered gas anesthesia. And we can control this very easily on our vaporizer. We can set it to the percentage that we want to reach our animals. They are CNS drugs. They're dose-related, and they are reversible. So in other words, if we lower the anesthetic gas, the effects of the anesthetic gas will slowly start to go away also. They can and will cause hypothermia. Anytime we give oxygen just alone, it can cause hypothermia, but mixed with anesthetic gas, it can absolutely do that. On the cardiovascular system, we definitely have some cardiovascular depression, and it's mainly based on the amount of gas anesthetic that animal is receiving, i.e. the more gas anesthetic that the animal receives, the more cardiac depression you're going to get. And the respiratory system, it's the same thing. It is dose dependent on the ventilation of the animal. Okay? Increased intracranial pressure in patients with head trauma or brain tumors. We can see some adverse effects on the CNS with halogenated compounds. Remember that we're talking about isoflurane and sevoflurane here. This drug is considered safe for epileptic animals, so if an animal is a seizure case, this drug can be used without any triggering of seizures. As far as the cardiovascular system, as I stated before, it is dose dependent, but as it decreases, as the animal gets deeper into an anesthetic plane, we can have decreased blood pressure, and it may actually decrease the renal blood flow, which we monitor with blood pressure, and it's a number that we're going to talk about in Chapter 6 called the MAP, which is mean arterial pressure. The respiratory system, it can cause hypoventilation, which essentially means that it can cause the respiratory system to slow down, i.e. the breaths that the animal is taking, and the tidal volume can be affected too, which means exactly how deeply in and out this animal can breathe. Because of this, carbon dioxide retention can happen, and as a result of that carbon dioxide retention, we can have respiratory acidosis. Remember, acidosis and alkalosis, when we talk about these things, we're talking about the pH scale in the blood. pH of the blood has to be maintained between 7.35 and 7.45 on the pH scale. You can see that is a minimal number. It is very, very specific. Any changes one way or another can result in acidosis or alkalosis. Acidosis would be anything below 7.35, and alkalosis would be anything above 7.45. Okay, a couple other things that we want to consider, and don't worry about partial coefficient, millimolar concentration, and rubber solubility. It's not anything that we really need to get into. There's a couple of things, though, we will talk about. Generally speaking, when we talk about vapor pressure, it's the pressure of an inhalation anesthetic to vaporize in its gaseous state. So what does it take for the liquid to be turned into gas? And it determines how readily an inhalant anesthetic will evaporate in the anesthetic machine vaporizer. Temperature and anesthetic agent dependent is the big thing. Just think of it this way: if you are out outside on a hot sunny day and you set a bowl of water outside, on that hot sunny day, the bowl of water is going to evaporate into the air much quicker than it would if you were sitting outside in a cloudy day at 40 degrees. So you can see that vapor pressure is very much dependent on the temperature, the environment that it's in, and it really should only ever be used in a controlled temperature, i.e. inside a building. This is not something that we take to farm calls or anything like that. We do not use gas anesthetics that way. Okay, so generally speaking, you have to understand that these are very volatile agents, and not only that, is they are flammable. So we really need to make sure that we understand that. They are under high vapor pressure in a vaporizer. Isoflurane, sevoflurane are the ones that we're going to use most in veterinary medicine. Don't worry about desflurane and halothane. They're delivered via that precision vaporizer to control the delivery concentration. All precision vaporizers are made to deliver only one specific halogenated agent. So in other words, you cannot put sevoflurane in an isoflurane vaporizer. You cannot put isoflurane in a sevoflurane vaporizer. They're set differently, and they require that specific gas to be used. Don't worry about non-volatile agents at this point in time. They are not ones that are used in veterinary medicine. They require a non-precision vaporizer, and they're a very risky way of doing gas anesthesia. Luckily, this day and age, we have everything that we need to not have to use non-precision vaporizers. All right, that concludes our conversation on isoflurane and sevoflurane. There is some more stuff in your book that you're more than welcome to read on your own. I tried to touch base on the most commonly used inhalant anesthetics that we have in veterinary medicine. Thank you.